This is Average Joe PT, and on last episode we talked about two main muscle groups, the rotatory and the rectus spinae for your lower back issues. So you'll hopefully watch it after you watch this episode. This episode specifically is going to talk about the iliopsoas muscle and the clicking, the internal snapping, all the pain that you're having in the hip. That's what we're going to talk about this episode. We're going to go over some main stretches that you need to do specifically for that internal snapping hip and generalized hip pain. So stay tuned. Generalized hip pain, snapping hip, internal snapping hip is what we're talking about today with the exercises as well as some pain relieving techniques that you're going to be able to do at home. So let's start out with what the heck is the iliopsoas? So that iliopsoas is this red band runs all the way up and comes all the way down. It attaches to another muscle within this side here called the iliacus. Those both come all the way down and come underneath your hip and attach on the back side. So as it looks here, you can do a few things. It allows your hip to go this way so you can bring your knee towards your chest. But the other important thing that it does that people don't realize is it allows you to bend forwards. People don't think about that. They're always thinking about that muscle as just a hip muscle, but it actually helps to bend that spine forwards, and also when you come back up, it also helps to decelerate that spine a little bit as it representing by this tendon here in this band. So when we look at that particular muscles plural, because there's two of them, actually technically it's three of them. There's a minor and major psoas, and then you have the iliacus. So there's three muscles really that come together to make that tendon, and you can get a tendonitis with it. You can get that snapping hip, and you're like, how the heck do I snap that hip? Really? Yes. How you do it is like this. I'm going to bring this nice and forwards for you so you can actually see what's going on here. So when you go ahead and bring that knee up like this, or that hip up, so you're bringing your knee towards your chest or towards your face, that tendon here can snap on a couple things. That little bone right there can snap on. It can actually snap on part of your pubic bone here. It can, what we call the pubic eminence. It can snap on this little piece right here and strum and catch on that. And just like a guitar string, when you do this all the time, guess what happens? This thing gets inflamed, it gets thick, it gets irritated, and all of a sudden you're having pain on the inside. Anytime you bend forwards or anytime you move that hip at all of a sudden you're getting a lot of clicking and popping and snapping and just generalized pain that can actually refer all the way down to your thigh. It can go down to your mid-thigh, it can come all the way up to mid part of your belly area. And there is a lot of stuff in here before you can actually get to this tendon. So if you've seen people trying to like massages and they're trying to get down in here, that's almost impossible. You have arteries and nerves and veins that I've talked about before. They run in a bundle and they're coming down here. Okay. You also have all your abdominal muscles. You have all your internal organs long before you get to this tendon. You know, you could maybe try and come in on the side of the bone here to come on in, but even then you're only getting the iliacus. You're not getting this the whole psoas piece because it runs so far up the spine and down. You're really not getting much. And then it runs so deep on the back side here where it attaches at, on the back side of your femur bone here, it's impossible to get at. But you can get a lot of butt pain here. Almost people might think it's piriformis syndrome, and it's actually coming from the tendon back here. So those are three main things that can happen. People might think it's a back problem. People might think it's some sort of piriformis issue, or they actually might think, hey, maybe it's coming just from in here. So it can definitely play games with different people and get you confused as well as your therapist or your physician. So if you like this episode so far, hopefully you'll leave me a thumbs up. Hopefully you'll hit the bell and subscribe. Hopefully you'll bring some more friends. Hopefully you like this content. I try and bring it a couple times a week. I also bring my research-based stuff. Which this week I'll be going over a couple big muscles, the rectus spinae and the rotatory. So hopefully you won't miss that one. Okay, so when we look at this main muscle right here, there's always three things that I like to talk about. I like first 72 hours, ice, anti-inflammatories, and rest. If this thing is inflamed, presenting like a tendon issue because it's snapping, it's clicking, it's giving you pain, start out with that. If you've already done all that before, what I want you to do next for me is I want you to go ahead and start out with a nice warm-up. So I'm going to show you this one stretch. Now this stretch is all over the internet, but I'm going to show you a specific way you need to do that no one else actually shows you on the net. I've looked and scoured. There's a lot of people that show you this stretch. They show you the incorrect way. So what you're going to do is you're going to have a pillow at your knee, and you're going to have something supporting you. I have the couch here, but you could have a chair or anything else. You're going to go ahead and lean forwards. You make sure that you're staying upright. You're not bending forwards. You're not overarching or extending your spine, and you're just going to lean forwards just a little bit. You're not going to go crazy into it because then you're just getting spine motion. You're not getting any hip motion out of this. And then what you're going to do is I'm going to show you a couple different views from the side. Okay, exact same movement. It's a slight movement. It's not drastic like you see a lot of people doing. And then you can get a different view from the back side also. So that's just a nice warm-up. That's the iliopsoas warm-up. So you want to just do that stretch 15 to 30 seconds, work your way up to a minute, and then just do that a couple times. That's it. You're not going to lengthen this tissue out any more than that. You're going to start to get compensation from your spine and also from anywhere along the chain where this muscle attaches all the way down through. You're going to get a lot of compensation otherwise. The next one I want you to do here is you can do this on the floor. I'm going to show you this in this position. This is called the hook lying position, or you can do it up on your bed, or you can do it on the couch, whatever you want to do. And I'm showing you with a nice piece of tape to kind of give you an idea of you just bring your knee to your opposite shoulder. Same exact stretch, 15 to 30 seconds. You're not twisting at the back. It's just a small little stretch. That's a gentle piriformis stretch just in case you're having issues at the distal part of the tendon. Now the last one you want to do, hey, if you have any questions at all, go ahead and leave me a DM down below and I'll get back to you as soon as I possibly can. Okay, now on to that third stretch. So if you're going to go ahead and do that stretch, you want to make sure that you've done these other two before, okay? You want to go ahead and warm yourself up before you do that. All right, so I want you to go ahead and subscribe down below, hit the thumbs up, hit the bell, and tell a few friends. I'll be right back. This last stretch, really, I don't understand why it's not shown. Anytime you're having any type of internal or even on the outside external hip popping, clicking, snapping, this group of muscles needs to be stretched. What they are is these are the inside muscles that run. I'm going to move the band out of here for a second for you and bring it up on close here. What this basically is they're attaching from the back here, from this pubic area and from this bone here, okay, this just above the femur, and they run all the way down on the inside. These are called your adductor muscles, and they get very tight on people. And this literally can affect your leg going outwards. So what you want to do, I'm going to show you here with some tape here, give you a good demonstration, is you're going to go ahead and stabilize the right leg, which is what we're stretching, and then allow that left knee to glide forwards just so you feel a little bit of a stretch on the inside of the hip here. You might even feel it down the thigh a little bit on the inside. That's your adductor stretch. Same thing. You're going to feel more of a stretch there than you are at the lunge or at the piriformis stretch muscle that I showed you. You're going to feel this very quickly because people don't stretch it. And this really is probably most of people's problems when we talk about the tight hip muscle. Less iliopsoas and more adductor muscles. There's adductor minimus, adductor magnus, okay? And so those huge muscle groups in there are really, really tight on people. So like I said, hold for 15 to 30 seconds, work your way up to 60 seconds, do it a couple times a day, 3-4 times a week. So that's really the 3 stretches you need to do when we're talking about internal hip issues. And if you like this episode, go ahead and leave me a positive comment. If you didn't like it, leave me a comment and hopefully I'll work on it. Until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.